Okay, so if you're studying to be an LPN and about to take that big exam, modified diets are a huge part of the material.
Yeah, definitely. They're all over those nursing nutrition guidelines, and it's super important to understand how to apply that information.
And that's what this deep dive is all about, right? We're going to break down the different types of modified diets, why they're used, what's in them, and what you as a future LPN really need to know to ace that exam and be awesome on the floor.
Yeah, we're going to make this clear and memorable so you can actually use this information in your nursing practice.
Exactly. So we'll cover all the main categories like liquid diets, starting with clear and full liquids, then onto pureed, then soft, bland, mechanical, soft, regular diets. And of course, dysphagia diets, which I know can be tricky.
Right, so let's start with the foundation, the regular diet. That's always a good place to begin.
Okay, so regular diet, that's pretty self-explanatory, right? It's for folks who don't have any specific dietary restrictions.
Right, it's the baseline. But here's the thing, it's also adjusted for age-specific needs. So an infant's regular diet looks very different from, say, a teenager's or an elderly patient's.
That makes sense. Different life stages, different nutritional needs. And another thing you'll see a lot of these days is the idea of self-select menus, even within a regular diet.
Yeah, I love that it gives patients more control over their food choices, which can really improve their intake and satisfaction.
Definitely. I mean, who wants to be stuck with the same boring food every day, right?
Yeah.
But even though it's called a regular diet, your role as an LPN is still super important.
Totally. You still need to think about the individual patient, their preferences, their usual eating habits, cultural or religious factors that might influence their choices.
Like some people are used to big hearty meals while others prefer several smaller ones throughout the day.
Right. It's all about personalization and recognizing when a regular diet is appropriate and then making sure it's actually working for that specific patient.
Okay, so we've got the baseline down. Now let's move on to something more restrictive, the clear liquid diet.
The clear liquid diet, well, it's all about hydration and providing fluids when a patient can't tolerate solid food.
So it's very limited in terms of nutrition, right? Primarily just for short-term use.
Think about things like water, plain tea, black coffee without any milk or cream.
Oh, and broth, right. Like fat-free chicken or beef broth.
Yeah, and clear juices like apple or cranberry ginger ale and plain gelatin.
Okay, so it has to be see-through, basically.
Right, it's about minimizing any residue in the digestive system.
Now, when would you typically see this diet ordered?
Well, it's pretty common before certain procedures like a colonoscopy, where the bowel needs to be completely empty.
Yeah, that makes sense to get a clear view.
Also for patients with certain GI issues like severe diarrhea or vomiting.
Or even right after surgery sometimes.
Exactly, in those early stages of recovery.
But here's the big thing for the exam. Remember, a clear liquid diet is not nutritionally complete. It's only for a short time.
Right, it's not meant for long-term use. It doesn't have the calories, protein, vitamins, and minerals that people need to thrive.
You can't live on broth and ginger ale forever.
Absolutely.
No.
So as an LPN, you need to understand when this diet is necessary, what to watch out for, like dehydration or electrolyte imbalances.
And be prepared to advocate for the patient's nutritional needs once they can tolerate more.
Absolutely. It's about knowing when to transition to something more substantial.
Okay, so we've covered clear liquids now. How about full liquid? What's the difference?
So the full liquid diet, well, it includes everything on the clear liquid list plus all liquids that are at room temperature.
Okay, so that opens up the possibilities a bit.
Right, so you can have things like milk and cream soups that are strained smooth custard.
Oh, and ice cream. Right, plain ice cream.
Yeah, and some places might even allow pureed vegetables in a liquid form.
So it's definitely a step up in terms of variety and nutrient content.
You get more calories and protein with a full liquid diet, but still it might not be enough for long term.
So if a patient is on this for more than a few days, say 3 or so,
they'll likely need some supplements to make sure they're getting all the nutrients they need.
like protein shakes or extra vitamins and minerals.
Exactly. You've got to fill in those nutritional gaps.
So when might you see a full liquid diet being used?
Well, it can be a transition step between clear liquids and solid foods,
Yeah.
kind of easing the patient back into eating.
Makes sense, taking things slowly.
Also, it's sometimes used after surgery for patients with certain GI conditions or when someone just can't tolerate solid food for whatever reason.
But there's a big caution here, right? For patients with dysphagia, swallowing difficulties.
Absolutely. If those liquids aren't thickened properly, they can actually increase the risk of aspiration. That's a serious concern.
And it's important to note that these days there's a move towards a quicker transition to solid foods when possible.
Yeah, the routine use of full liquid diets is becoming less common as we learn more about the benefits of getting people back to regular eating sooner.
That's good to keep in mind for the exam. All right, let's keep moving and talk about the blenderized liquid or pureed diet.
Puree diet. Okay, so here we're talking about taking regular foods and blending them to a smooth liquid consistency.
So it's more than just throwing some stuff in the blender with water, right?
Absolutely. You can really customize this diet to meet the patient's individual needs.
Like you can adjust the calories, the protein, the fat, the thickness.
Right. And instead of just water, you can use broth milk, cream, gravy soup, tomato sauce, fruit juice to add calories and flavor and nutrients.
Oh, and you can puree foods separately to preserve their individual flavors. That's a good tip.
It makes a big difference because you don't want everything to taste the same. That can make it really unappetizing.
Now, who would typically need a pureed diet?
Well, think about patients with chewing or swallowing problems, like after oral or facial surgery.
Or if they have a wired jaw.
Exactly, or conditions that affect their ability to chew and swallow safely.
So this is where your skills as an LPN come in, knowing how to make this diet both nutritious and appealing.
Yeah, it's about creativity and using those tricks to make sure patients are actually getting what they need despite those limitations.
It's like you're a culinary detective solving nutritional mysteries.
Exactly. All right, now let's move on to the soft or bland, low-fiber diet.
This sounds a bit gentler on the digestive system, right? What's the idea behind this one?
So a soft diet is all about foods that are easy to digest, low in fiber, and not too irritating.
So kind of taking it easy on the gut.
Right. And the textures can vary. It can be smooth, creamy, or even a little bit crisp, depending on the patient's tolerance.
And the whole bland thing, that means avoiding strong spices and seasoning.
Yeah, you want to keep it mild and soothing.
So what kinds of foods would typically be included?
Think cooked fruits without skins or seeds, cooked vegetables, tender meats, fish, poultry, eggs, refined grains, things like that.
And what would you avoid on a soft diet?
Raw fruits and vegetables, coarse breads and cereals, beans, nuts, seeds, anything high in fiber or known to cause gas.
So it's all about minimizing any potential irritation.
Right. And when would you see this diet prescribed? Well, often as a transition between a full liquid diet and a regular diet.
So kind of that middle ground.
Or after an illness or infection or someone has trouble chewing.
But there's a potential problem here, right? Constipation.
Yeah, because it's low in fiber, it can definitely lead to constipation, so you have to watch out for that.
Monitor those bowel movements, make sure things are moving along.
Exactly. Provide fluids, encourage movement, whatever's appropriate.
So understanding those potential complications is part of the job.
For sure.
Yeah.
All right, let's move on to the mechanical soft diet. What sets this one apart?
Is it just about the texture?
Well, primarily, yeah.
Right.
It's a regular diet, modified in texture, so it requires minimal chewing.
Okay, so like ground meats, soft-cooked veggies.
Exactly. Things that are easy to manage in the mouth.
You can add things like butter gravies, sugar honey to boost calories.
Right, because sometimes the portions might be smaller if chewing is a challenge.
But you would avoid things like tough meats, raw fruits and veggies, anything with seeds or nuts.
Right? Anything that requires a lot of chewing is out.
So when would a patient need a mechanical soft diet?
Often after dental work, when chewing is painful or if someone has poorly fitting dentures or no teeth at all.
Or if they have dysphagia, some difficulty swallowing?
Yeah, although for more severe dysphagia, you'd use a specific dysphagia diet.
Okay, so as an LPN, you need to know what textures are okay on this diet and how to help patients get enough calories even if they can't chew as much.
Right. It's about finding ways to make sure they're still getting good nutrition.
Okay, now on to a really important topic, dysphagia diets. This is especially crucial in stroke care and other conditions that affect swallowing.
Absolutely. So dysphagia is difficulty swallowing, and it can happen for a variety of reasons.
Like after a stroke, a brain injury, certain neurological conditions.
Or even some medications can cause it.
And it's important to be able to recognize the signs, right? Like drooling, pocketing food in their cheeks, coughing or choking while eating or drinking.
Yeah, or having a gurgly voice after swallowing. Those are all red flags.
And that's where the IDDSI framework comes in.
Yes, the International Dysphagia Diet Standardization Initiative. It's a godsend for standardizing those dysphagia diets.
So IDDSI lays out specific levels for both liquid and food textures, right?
Exactly. So no matter where you are in the world, you know what level 3 or level 5 means.
It helps ensure consistency and ultimately improves patient safety.
Big time. So let's break down those liquid levels first.
Okay, starting with level 0.
Level 0, that's thin, just like regular water flows, easily can be drunk from a cup or straw.
The most basic level.
But you've got level 1, slightly thick, still thin enough for a straw, but a little bit thicker than water.
Like maybe a little bit of a coating left on the cup.
Right, then level 2, Mildly thick. These flow slower, and you might need a little more effort to drink them through a straw.
You can sip them from a cup or take them with a spoon.
Level 3, moderately thick. These are smooth, no lumps. You can drink them from a cup or eat them with a spoon, but they won't flow through a standard straw.
Getting thicker and thicker.
And finally, level 4, extremely thick. This is spoon thick, holds its shape, and has to be eaten with a spoon.
Like pudding almost.
Exactly. So it's a clear progression from thin liquids to something almost solid.
Okay, now what about the food textures in IDDSI?
So for food textures, we've got levels 3 through 7. And remember, level 3 liquidized is the same consistency as liquid level 3.
So moderately thick.
Right. And level 4 pureed is the same as liquid level 4, extremely thick.
Okay, that makes sense, keeping it consistent.
Then we move on to level 5, minced and moist. So we're talking about soft foods with small lumps that are easily mashed.
Like no bigger than 4 millimeters.
Right. Easily manageable with minimal chewing.
Level 6, soft and bite-sized. These are soft, moist foods cut into bite-sized pieces no bigger than 1.5 centimeters.
No need for a knife. They should be easy to chew and swallow.
And finally, level 7.
Level 7 has 2 categories. Easy to chew, so those are near normal textures, but still moist and tender, no hard, sticky, or stringy bits.
And then regular, which is just normal, everyday food appropriate for the person's age and development.
Right, so that's the whole spectrum, from completely smooth to regular textures.
Wow, that's a lot to remember, but it's so important, especially for those patients with dysphagia.
Absolutely. You have to know those IDDSI levels like the back of your hand. It's all about safety and preventing aspiration.
Okay, let's shift gears a bit now and talk about nursing assessment and interventions when it comes to modified diets.
Because it's not just about knowing the diets, it's about applying that knowledge in real-life situations.
Right. So what are some key things to keep in mind as an LPN?
Ongoing assessment is a crucial monitor. The patient's weight daily. Check those lab results, evaluate their nutritional needs, and how they're responding to the diet.
And don't forget to actually observe and document how much they're eating.
Yeah, sometimes you might need to do a calorie count to get a really accurate picture of their intake.
And of course, patient education is a huge part of the job, explaining the why and how of the diet to the patient and their family.
Absolutely. And being supportive, answering their questions, addressing their concerns.
Now, what about that term diet as tolerated? What does that mean in practice?
It means you have to use your judgment and consider the individual patient.
Like if someone is on a soft diet and they really want a baked potato, which isn't technically allowed.
Well, if they're tolerating the diet well and there's no medical reason why they can't have it, a small baked potato might be fine.
It's about being flexible and patient-centered within those guidelines.
Exactly. Using common sense and listening to the patient.
Now, before a patient even starts a modified diet, what kind of assessment do you need to do?
You want to get a good baseline, assess their hunger, their appetite, any nausea or other symptoms that might affect their eating.
And if you have any concerns at all about their nutritional status or the prescribed diet,
don't hesitate to consult with a registered dietitian. They're the experts.
Teamwork makes the dream work, right? And what about after surgery? There's usually a specific progression of diets.
Yeah, so typically after a major surgery involving the GI system, it's NPO, nothing by mouth at first.
Then once bowel function starts to return,
you can move to clear liquids, then maybe full liquids, then a soft diet, and eventually back to a regular diet.
But that return of bowel function is key, right? You're listening for bowel sounds and checking for flatus.
Absolutely.
Yeah.
You don't want to advance the diet too quickly before the gut is ready.
So all these things, ongoing assessment monitoring, intake, patient education, understanding those diet progressions, it's all critical for the LPN role.
It's about connecting the dots between the textbook knowledge and real-world patient care.
So as you're studying for your exam, think about how you're going to apply these concepts in practice, how you'll assess your patients, how you'll communicate with the healthcare team.
It's about putting all the pieces together to provide safe, effective, and compassionate care.
Well, we've covered a lot of ground today. I hope this deep dive into modified diets has been helpful and given you a solid foundation for your exam.
And remember, it's not just about memorizing facts. It's about understanding the why behind each diet and how it fits into the bigger picture of patient care.
So as you continue your studies, think about this, considering all these different diets and the unique needs of each patient. What strategies will you use to make sure you're providing the best possible nutritional support?
It's a challenge, but it's also incredibly rewarding to see how the right diet can really make a difference in a patient's recovery and well-being.
That's what it's all about, right? Best of luck on your LPN exam. You got this.
Yeah, go out there and be amazing nurses.
That's a wrap for the deep dive. Thanks for joining us.
See you next time.